We're live.
Okay, good evening, everybody. I'm so sorry about the delay. We had some technical difficulties getting started. But thank you so much for joining us tonight for Let's Talk Back to School Immunizations. My name is Megan Williams, and I am the parent of 4 children that go to Buncombe County schools, and I am happy to be here to talk with some of our local experts about how to keep our children healthy this school year. Perhaps some of you can relate to this, but I know that my household goes into a crisis mode whenever any of my children get sick. We're trying to figure out childcare and how to get our work done when we have a sick child at home. And so I am super interested and invested in making sure my kids can go to school and be safe at school this year. So I'm really interested in hearing about how to keep my children healthy so they can go to school and learn from these amazing educators we have in Buncombe County. So I want to let you all know that tonight's event is being simultaneously interpreted into both Spanish and American Sign Language. Spanish interpreters Rocio and Carla were connected to this project through Sinzontle, an Asheville-based language justice co-op providing interpretation and translation services so that Spanish-speaking residents can have access to the information they need to thrive. Crystal Bradley and Ginger Smith are tonight's American Sign Language interpreters. We're so grateful for this team of individuals who work tirelessly so all members of our community stay up to date on the most current information impacting the lives of Buncombe residents. We'll have a momentary pause at about 6 p.m. halfway through, well, it's probably about 6:15 p.m. halfway through our event, so our interpreters can switch positions. And that'll just be a quick 30 seconds or so to complete that process. So please just bear with us during that slight pause. I wanted to also let you know that if you want to watch this in English, you should go to the Buncombe County Government Facebook page, and in the Spanish version should be on the Buncombe County Health and Human Services Facebook page. You can please put questions in our chat box on Facebook, and we'll have someone monitoring that chat box, and they will pass those questions on to us to answer live if we have time. Okay, so without further ado, I'd like to have our panelists go ahead and introduce themselves. Let's start with Dr. Mullendor.
Good evening. I'm Dr. Jennifer Mullendor. I'm the Medical Director for Buncombe County Health and Human Services.
Dr. Fogelman.
Hey there, I'm Bridget Fogelman. I'm a pediatrician with Asheville Children's Medical Center and the mom of 2 Buncombe County students as well.
Ms. Baggett.
Hi, I'm Shannon Baggett, principal at Montford North Star Academy with Asheville City Schools, and I'm a mom of a middle schooler in Asheville City Schools.
Ms. Carter.
Hi everyone, my name is Portia Carter and I'm a senior at the School of Inquiry and Life Sciences at Asheville.
And Ms. Bauer.
Hi, I'm April Bauer and I'm the program manager for the school health program. So we have all of our school nurses in Asheville City Schools, Buncombe County Schools, and some of our charters. And I have 2 school-aged kids myself.
Great. Okay, so it sounds like a lot of us are very invested in this topic. All right, so to start off, if we think it would be kind of helpful to get a vaccination sort of landscape in Buncombe County. So Dr. Mullendor, if you don't mind, could you share with us what we know about vaccinations in Buncombe County, both historically and currently, and maybe what the implications are for that for this coming school year?
Sure. And I'm going to start actually to talking about like the bigger picture, US, and how the COVID pandemic has affected immunizations, and then drill down into Buncombe County. So I think we can all understand that the COVID-19 pandemic has had a significant and prolonged impact on everything about our lives, and that includes routine immunization rates. So all the way back in March of 2020, when the US declared a national emergency due to COVID-19, pretty quickly we saw significant decreases in the number of doses of childhood vaccines that were ordered by healthcare providers, again, across the United States. And we're talking about a decrease of 3 million doses, ordered by providers across the US between January and through April of 2020 compared to the same time the prior year in 2019. So why was this? Well, if you recall, we had stay-at-home orders that were in place all across the country. People were staying home to prevent being exposed to this new virus. Families weren't taking their children to see their doctor for routine well care, and healthcare providers were changing how they provided care. So those vaccine orders have rebounded since then, but there's still a significant deficit for 2020 to 2021, over 13 million doses. And that decrease has been greater with certain vaccines. Many vaccines that are mainly given to younger age children have smaller gaps than those given to older children. So vaccines that we give to adolescents, so like the Tdap, the HPV vaccine, and the meningococcal vaccines are down by as much as 14 to 18% compared to 6 to 9% for vaccines that are given to younger children. Measles containing vaccines, again, this is across the US, are down by 18%. But there's thought that some of this may be due to, we're comparing to 2019. That was a year when we saw large measles outbreaks. And so we increased the number of measles containing vaccines that were ordered and administered in that year. We've also seen that the pandemic worsened racial and ethnic disparities in flu vaccine coverage. And when we review health insurance claims data from across the United States, adolescent vaccine administration improved slightly in the fall of 2020, but largely remained well below 2019 levels. So that's the US picture. I reviewed Buncombe County specific data, and it appears that we've seen a slight decrease in immunization rates for our 2-year-olds countywide. At this time, this month, 69% of those 2-year-olds are up to date on their recommended vaccines, compared to 70 to 71% for the prior 2 years. And we know, and I'm going to show a slide here. I can do this real quick. All right, can everybody see that? All right, so we know that in Buncombe County, we have the unfortunate distinction of consistently having the highest rate of kindergartners who are not fully vaccinated, mostly due to the claiming of religious exemptions by some families. And this has been an increasing trend since the early 2000s. 94 to 95% of kindergartners in each of the last 5 school years have been fully vaccinated, with 4.5 to 5.9% of these students having a religious exemption to at least one required vaccine. In comparison, the statewide rate of religious exemptions for kindergartners has ranged from 1.1 to 1.6% during that same time. And when we look at individual schools, there can be great differences, with some kindergarten classes having 25 to 50% of students who aren't fully vaccinated. So per the data, that last data point on the slide, per the data from the North Carolina Department of Health and Human Services Immunization Branch for the 2020 to 2021 school year, last school year, 6% of kindergartners in Buncombe County had not obtained their required immunizations by the deadline, which was up from 3.4% the prior year. And as on this slide, 4.5% claimed a religious exemption, which was down from prior years. And our thought is that, again, based on historical trends, we wouldn't necessarily expect that drop. And so maybe the percent claiming a religious exemption might have been higher if more families had submitted the required information by the deadline. We did also see a drop in kindergarten enrollment in our schools, about just over 300 students less from the prior year. So it's also possible that families, due to the COVID pandemic, those families that might have claimed a religious exemption chose homeschooling instead, and so didn't show up in this data. We didn't see a change in our medical exemption rate. It was 0.1% of students claimed a medical exemption, so that's stable from prior years. So, COVID-19, definitely trying to get my screen back up here. Sorry, I can't talk and do this at the same time, can I? All right. Here we go. I have to move my mouse between my different screens, and that's what's causing the problem here. All right, we're all good now, right? No more sharing screens. Okay. So, we know COVID-19 had a significant impact. I think we're eager to see now that kids are going back in person, what will our immunizations rates be this year?
Do any of our other panelists have anything to add? Thank you so much for that background. That was really helpful. Anyone else? Okay, well, so we'll move on to my next question. So vaccination rates have been kind of historically lowish in Buncombe County, and the pandemic caused them to drop even more. So it sounds like a lot of families were unable to get their regularly scheduled checkups for kind of a variety of reasons, including COVID. So what can we do about that? Maybe Dr. Fogelman, you want to start?
Sure. So most of the providers in the area, I feel like, have tried to accommodate the schedule to get kids back in the office to be able to get caught up on their immunizations. So the first thing I would recommend is to call your child's medical provider and try to get an appointment to get caught up on immunizations if they need any. And then if they are unable to have an appointment in a timely fashion, then you can go to the Buncombe County Health Department and get them as well. Really a fairly seamless process. Some of the pharmacies will give some of the older children immunizations also. I think it's best to have a conversation with a provider, but a pharmacy is oftentimes a faster option as well.
Great. And so if folks are interested in getting their vaccines at the Buncombe County Health Department, where, Dr. Mullendar, can you tell us a little more about how they could do that?
Sure. So our health department is located at 40 Cox Avenue in downtown Asheville. And, we do with COVID, things have certainly changed. And so we do offer people the opportunity to schedule appointments, as well as have some limited walk-in hours. And so I would direct people, just easy to call our immunization clinic at 828-250-5096 to see, what are the specific hours. As with COVID, like, everything's changing frequently. And so I think that's the best recommendation, is to call our immunization clinic and either schedule yourself an appointment or find out when our walk-in hours are.
Great, thanks for that. So maybe we could talk a little bit about why vaccines are important, specifically in the student population. Like, what's some of the science behind vaccines? Why do we even want to get our kids vaccinated to begin with? Dr. Fogelman?
Answer. So when you have a large group of people, in particular small people like children, germs spread really easily. And what we can do to help prevent the spread of dangerous germs that can cause hospitalization, death, serious illness, is to help our bodies have protection against those germs. So by getting a vaccine, your body creates these chemicals that then help you not get sick with the illness for which you're getting the vaccine. And by doing so in a large enough group of people, then the germ won't have the opportunity to circulate or to spread as easily. And in particular with babies, for instance, in daycare, a lot of these germs are airborne and spread just by the air that we breathe. And so the only thing you really can do to prevent these types of illnesses is to have the vaccination, so that your body can have the chemicals to produce the protection against getting sick with those germs. And then in elementary school, same concept, that kids are obviously little vectors of illness. They spread germs easily. They touch things, they put their hands in their mouths, they sneeze on each other, cough in each other's faces, and that can spread germs very easily. So by everybody getting vaccinated, or the majority of people who are able to getting vaccinated, then we can keep those germs out of the school setting and from spreading from child to child.
And this a little follow-up question, it might be for Dr. Mollendor, but what are some of the potential impacts that might happen if we don't have our vaccination rates kind of recover from where they are right now? Can you talk a little bit about that?
Well, I mean, we've seen it in our county, right? If you can remember, prior to COVID, just a few years prior to COVID, we had a very large outbreak of chickenpox in a school where there were significant numbers of children who were not vaccinated against chickenpox. We routinely have outbreaks of pertussis. And then again, on other parts of this country, like I mentioned before, huge measles outbreaks in highly unvaccinated populations. And, you know, these illnesses are, you know, some people can have mild cases and some people can end up in the hospital and some people can die. And so, you know, we know that vaccines can work. We know that they're safe and effective, and can keep those kids in school. And I think Shannon or April can speak to that, the value of kids being able to learn at schools.
Yes, absolutely. As we all know, having kids physically present in school is really important. I think we all know that now more so than ever. And, you know, in a school setting, we require that families report their child's vaccination status when they enter kindergarten and in 7th grade, and then again in 12th grade, because at various times of a child's life, they're getting various shots and boosters, and we do ask families to produce those records. Of course, there's also a religious exemption as well, and we do see a high religious exemption. But, you know, all of the vaccinations are very, very important. You know, as school systems, we feel like we want to help contribute to overall public safety. And being vaccinated is one of those ways that we can help stop the spread of infectious diseases. And we want to make sure that kids are in school and healthy as much as possible. So we, you know, in Asheville City Schools, we've had a couple of vaccination clinics, not just for COVID, but for some other vaccinations as well, this past summer, I believe. And actually tomorrow at Montford North Star at my school, we are hosting a COVID vaccination clinic from 9 to 12. So if anyone is interested, we will, I believe it's just the Pfizer vaccination that will be administering by the health department from 9 to 12 at Montford North Star Academy tomorrow.
Thank you. That's really important. And another thing of interest to parents, maybe April, you can answer this question, but what happens to kids that are unvaccinated in a school when there's an outbreak of a vaccine preventable illness? So if they're unvaccinated for whatever reason, can you tell us kind of what the procedure is there?
Yeah, definitely. So when you look at a disease like chickenpox, which I think we all know is super contagious, what actually happens is that if a child is unvaccinated, they have to stay out of school until we get to a point of 21 days from the most recent case. So you can have multiple cases that could stretch over many weeks, and the student who's not vaccinated would have to stay home from school for that entire period unless they were to get vaccinated, in which case they could return. So that definitely has the potential to have a significant impact on the student's ability to be in school, to be getting access to education, and that's something that we really want to avoid as much as possible.
Okay, thanks. And so another question I have is, what are some of the checkpoints? I think Ms. Baggett answered this somewhat, but what are some of the checkpoints when we expect kids to have vaccines? And when are those required throughout a student's educational career? And maybe what are some of the reasons for why those are required at those points? April, I don't know if that's something, would you like to take that question? Is that one you can?
Sure. So as Shannon mentioned, kindergarten, 7th grade, and 12th grade are all kind of built-in checkpoints where we do look for specific vaccines or boosters. Also, outside of school, there are vaccines that are required for daycare for children that are a little bit different. So I would say if you've got a student going into any of those grades, definitely make sure you know what's required. And hopefully you do, because we try to get that information out to parents and families. But I think that the science behind when vaccines are given is really specific to the risks related to that disease at that age, and then how immunity can sometimes wane over time, and that's when the boosters are needed. For example, with students who are entering 7th grade, they have to have a first dose of a meningitis vaccine, and then they need a booster before they go into 12th grade. And same thing with Tdap in 7th grade. That's actually a booster from the previous DTaP series that they would have had when they were younger.
Go ahead, Dr. Fogelman.
If it's okay, I'd like to just piggyback on that a little bit. The vaccines that have been in place that are required have been so studied for many, many years to know what the antibody levels, the chemicals that give the protection against the germs, what antibody levels are sufficient to produce that protection, when they start to fade, the amount of time between doses of vaccines. And so these are not random time frames that are chosen about having vaccines at certain times and intervals in between. These are very studied sets of information as far as the regular school immunizations are concerned.
Great, thanks. So this question is kind of for everybody, but Portia, I'm going to start with you, if that's okay. School starts back in just 5 days. So what is the general feeling from staff, administrators, students, as the in-person school year approaches?
All right, yeah. I can say a big feeling that I bet everyone has, staff, students, everyone included, is we're excited. We're excited to go back to school, be able to interact with people, have that social interaction, be able to get back into class and take in that knowledge that way. I think it's super exciting, along with sports and just other stuff that you get at school that you wouldn't get at home in virtual learning. I can say that there are also some anxious feelings. Not for everybody, but for some people like me, I live in a household where someone is high risk. And so for COVID, it's very anxious. I'm a little bit nervous myself to go back, but it's all with excitement as well. So I think everyone's super excited to go back, but a little bit anxious, but that's all, it just comes with it. This has been a long time since we've been back in school. Myself, I haven't been in a year and a half. So since the middle of my sophomore year, I'm going to be a senior this year. So I haven't been to in-person learning in a very long time. So it's exciting to be able to go back.
I can tell you also in my practice with the children and the teenagers I've seen throughout this pandemic, they definitely prefer to be in school. And we need to do everything we can do to make that happen for them. They definitely learn better in school. I've never seen the amount of depressed teenagers I've seen in the last 18 months or so. And it's heavy. These kids need to be in school.
Yeah, going off of that, it was a dramatic shift from going in person straight to virtual learning. It was no kind of easing into it. It was just this dramatic shift from seeing your friends and everybody and just that social interaction on a daily basis, considered to being locked in your room, staring at your four walls every single day. So like you said, the amount of depressed teenagers and stuff, I can definitely say that is true. And I know many people who definitely did struggle throughout virtual learning. And as you said, being in person is completely different than virtual. You grasp knowledge differently. You're able to interact, have that teacher support right then and there compared to learning online. So yeah.
Ms. Baggett, do you have anything to add about what you've seen?
Sure. And, being a mom myself, I get it too, with my child and, losing that social interaction, that was extremely difficult. And just yesterday with my faculty, we had a big retreat, and in talking, I think Portia said it best, even as a student, the teachers are feeling the same way. They are very, very anxious, but they're also extremely excited. We miss our kids, and we miss that, normal school environment, whatever that looks like again. but we're ready. We know it's going to be a challenge, but we're definitely ready. The phrase cautiously optimistic keeps coming, to mind. So we have great intentions. We're really excited. We're ready, but also being very cautious at the same time.
So in light of that question and kind of cautious optimism, maybe you can speak a little, and perhaps April, you can as well, to what schools are doing to make sure students can stay safe and in class this year. What are some of the measures you've taken or will be taking?
Shannon, do you want to go or you want me to go? Either way.
I'll go ahead and start. I really have to say, through Asheville City Schools, which I can only speak of, we are in constant contact with our health department and April Bauer. I feel like April Bauer is a part of our staff of the past year and a half. We've worked very closely to make sure that we're following guidelines, from the state, from the local health department. And, now going back into school, a lot of the things that we were doing back in the spring, we're still doing just to, maintain safety. In Asheville City Schools, we're doing some universal masking. We still have a lot of our cleaning protocols of our custodians cleaning those high contact surface areas throughout the day. And all of our classrooms have cleaning supplies. We've been looking at ventilation systems in all of our schools. We're also been looking at putting air purifiers in each of our classrooms just to get some extra circulation in every room as well. We, the biggest thing is really educating our kids and our families about properly wearing the mask, because all the guidelines that we've been getting says that that's like your number one defense, is covering your nose and your mouth properly at all times when you're indoors. Maintaining, at least now it's 3 feet of social distancing. So a big piece of staying healthy is just educating our kids and educating our families. Now that there is not a requirement to do screening when kids come back, we're definitely requiring families to self-monitor and make sure that they have those COVID symptoms in front of them at all times, and making sure that if students and staff, if any of us are sick, it's very important that we do not attend school. But we are keeping a lot of those safety measures that we had back in the spring. Of course, some of them, according to our North Carolina Strong Schools Toolkit, which is what we're following. Some of those measures have been laxed, but we're always erring on the side of caution.
And I'll just add, I think last year we learned a lot. We learned a lot about how to keep kids in school safely, and we're doing those same things. Like Shannon was saying, universal masking, distancing, getting kids outside as much as possible, because we know that that reduces the risk. Hand washing. I think at the beginning of the pandemic, I was really concerned by the number of people that didn't know about hand washing, but now we all know, and we're doing it all the time, which is great. And I also just think too, really encouraging vaccination for anyone who's eligible, our students who are 12 and older, our staff. Masks are super effective and important in keeping transmission in schools low, but vaccines are our number one most effective prevention measure that we have. So I think that it's, kind of a combination of strategies. We talk a lot about layered safety measures, and I think that we have those things in place, along with some rapid antigen testing available in schools to quickly identify those positive cases. And yeah, we're really lucky to have an excellent relationship with our local health department. Dr. Mullendor is on speed dial for sure. And we've had a really, I think, great channel of communication between all of our schools, our school health program, and the health department. So I feel really good about what we're doing.
I would also like to emphasize the importance of some of the measures in the community as well. Most of the cases that I see have not been through school or day camps or any of that over the summer. It's been through play dates or having company or cookouts or hanging out with friends. We all want to continue to do that. And I think we can do that safely if we can also mask up in the community as well. Try to maintain distance. Try to, if you go to eat out, maybe eat outside, just simple things that we can do to help decrease the amount of COVID in the community also. And for those that can get immunized and get vaccinated against COVID, please do so, 12 and up. It's safe, it's effective, it helps prevent the spread. For the most part, it helps keep people out of the hospital, keeps the death rate lower.
Thank you for all those points. I'm going to let our Spanish and sign language interpreters switch. So I'll pause for just a second to let that happen. If y'all would just give me a thumbs up when you're ready and we'll go back, okay? And just waiting for something from the Spanish folks when you get a chance.
You're good.
Okay. All right, so we have a couple of questions that have come in that I'm gonna try to get answered for y'all. So the first question I have is a question about the religious exemption and whether the guidelines on the exceptions are being revisited in light of the current pandemic. So I think that might be a Dr. Mullendorf question.
Sure. So in the state of North Carolina, because these are exemptions are regulated by state law. So in the state of North Carolina, we have two allowable exemptions from required immunizations. One is a medical exemption, and that has to be certified by a physician licensed to practice medicine in North Carolina. And there's a form, a state form that has to be filled out and signed and submitted. It's very rare that somebody would have a medical exemption to a vaccine. Vaccines overall are very safe, and so it's very rare that somebody would need that. The only other type of exemption allowed in North Carolina is called a religious exemption, and it reads as, the adult or the parent guardian has a bona fide religious belief that is contrary to immunization requirements, and there's no form from the state for these religious exemptions. A parent or guardian has to write a written statement of their religious objection to an immunization and then provide that to the school or child care program. Some states have philosophical or what's called a personal belief exemption, but that does not exist in the state of North Carolina. I have not heard of anything in this state or really even across the country related to the COVID-19 changing exemptions. The measles outbreaks that we had in 2019, there were changes in several states that actually removed the religious exemption as an option and left only medical exemptions in place. But again, that has not anything that I've heard more recently related to COVID-19.
Thanks, Dr. Mullendorf. All right, next question. There's a question about FDA approval. What does it mean? Is it safe without it? So in other words, is this emergency, what does the EUA stand for? The EUA, the approval that we currently have, what is the difference between that we currently have now and full FDA approval, and is it safe prior to full FDA approval?
Do you want me to take that one too? Okay. So EUA means emergency use authorization. So typically for vaccines to be available to the public, it takes years, right? Years of research and data submission and review. But in the midst of a global pandemic, we don't have years to wait, right? People are dying, people are ending up in the hospital. And so, these types of vaccines that are being used for COVID-19 are based on and built on technologies and other vaccines that have been around for decades. There were clinical trials, very robust clinical trials with tens of thousands of individuals. That data was reviewed by science advisors and scientific experts. And, we always have to compare the risk of vaccination to the risk of the illness it is preventing, right? And so we know how devastating COVID-19 is, right? We know the just devastation it's causing in terms of cases and illness and hospitalizations, death across the world. I mean, it's very apparent. And so the clinical trials were, the vaccines were proven to be safe and effective. And so that's the FDA was able to grant this emergency use authorization. The data is still being reviewed, right? So we have administered hundreds of millions of doses of vaccines now, and so we have very robust safety systems in in this country, and so those are constantly being monitored, and we've seen evidence where they've worked, right? So when there were reports of very rare but significant blood clots related to the Johnson & Johnson vaccine, there was review of that. There was actually a pause on the use of that vaccine, review of the data, and then recommendations were made. We saw the same thing with the reports of myocarditis and pericarditis with the additional vaccines, the mRNA vaccine. So, it's responding to the crisis at hand, but continuing to base everything on science and data and evidence. And so, I did not hesitate to get vaccinated when I was offered vaccine. I did not. I did not ask anyone else to hesitate. My parents, my grandmother, my husband, my brother and sister, and hopefully one day very soon, my 6-year-old will be vaccinated because we are seeing benefit from those. So I feel that the safety of those vaccines far exceeds the risk of COVID-19.
And the transmissibility, or how easily you get this Delta variant of COVID, is so high. I mean, you can catch it so easily. I feel like if you're out in the community, you're getting exposed, most likely. So the best thing you can do is to give yourself the protection and to keep it from entering your home until the younger kids are able to get the vaccine. That data should be coming out next month in September. They will not rush that process. When you hear this headline recently about the American Academy of Pediatrics asking the FDA to rush the approval for kids, it's not rushing any of the data or the science behind it. It's looking at the data that they're asking them to prioritize that. So I've been getting a lot of parents that are asking me like, oh, they're rushing this through. And it's the American Academy of Pediatrics is a very good resource, and they would not do anything that would endanger children or their well-being. So when you hear that headline about the AAP or the American Academy of Pediatrics pushing this, it is not rushing any of the science. It's just asking for it to be a priority to be looked at.
Thank you both for that. All right, another question we have is, what can families do to mitigate spread at school? So how can we support staying in school and avoiding a return to remote learning?
I'll go, if that's okay. Yeah. I'll just say first, I've been super impressed from the beginning. I think there was a lot of concern that kids won't wear their masks properly at school. They're going to touch their face all day. They're going to trade masks. We heard all kinds of concerns, and it turns out kids are actually really good at wearing masks because they want to be in school and they understand why it's important. So I would say just, kind of reiterating with your children, reminding them about the masks, about, how to wear them, how to take them off, making sure that the masks are being cleaned appropriately at home, reminding kids again about washing their hands, and monitoring them for illness. I think somebody mentioned earlier, don't go to school if you're sick. Don't send your kids to school if they're sick. You can get them tested pretty easily, I think, right now in our community for COVID. We have a lot of options available. Definitely check in with a medical provider. And then, just doing those things that we talked about too in the community and at home to stay safe and keep your kids healthy. When you're socializing with other families, really thinking about where you're doing that, trying to do it outside, trying to limit your bubble, and, again, enforcing the masks, the distancing, and those things that we know are effective. That's what I would say. And get vaccinated if you haven't and you can.
I'm not seeing other questions necessarily. So why don't we go ahead and start with our closing remarks from each of you, and then if we have some other questions that come up, we can go ahead and answer those as they come in. So Portia, I'll let you go ahead and give your closing remarks. Maybe since you're a student yourself, you could address if you had a chance to address your fellow students, maybe what would you say to them?
Yeah, something I would definitely say is myself as well as my fellow students, we want to be back in school, and a way we can do that is by having majority of the school be vaccinated. So I do encourage my fellow classmates to get vaccinated if you can, if there's not anything limiting you. I do know that a lot of my classmates as well have some of their parents who not necessarily want them to get vaccinated, and that's totally valid. So maybe having conversations with your parents and letting them know that that might be something that you want to do if that is. I do totally encourage it. I'm double vaccinated, have been for a couple months now. Again, my family is high risk, and so just thinking back that being vaccinated doesn't only help yourself, but it helps the people around you and people's family members that might not be so okay if they do get COVID. And so, yeah.
Thanks. I had one other question that quickly came through. So Dr. Mullendorf, if you wouldn't mind answering this one. We had someone ask whether there were specific recommendations around masks for kids, for different age kids.
I don't know that I've seen anything specific about kids, but in general, the best masks are going to be ones that are at least 2 layers thick fabric. So I have my mask here, right? So I have, 2 different types of fabric. Clearly, it has to completely cover your mouth and nose. So something that's well-fitting. So early on in the pandemic, I had a mask and it kept falling down because it just wasn't as form-fitting. And then I found a local person who made these masks, and I've loved them ever since. So it has a good metal nose piece that I can push in to make it fit tighter there, because you want it to fit snugly. And so you don't want it to have gaps. And so they have the masks that fit behind your ears. I don't like that. That irritates me. And so, and I think my kid didn't like it either. So I got masks where I have an elastic strap that goes around the top of my head and the back of my head. And so finding something that works for your kid that they're not going to be messing with, it's going to stay in place when they're moving around, I think is really important. And sometimes it's just trial and error to see what works and what's comfortable. But there is guidance on the CDC website about how to choose a mask. And it's a way to, if you know people who are handy seamstresses or tailors, great. Sometimes, again, there's local businesses and craftspeople who are making these types of masks.
So you can support your local businesses too. Mm-hmm. And I will say, as a parent, I notice my kids are actually a lot more disciplined with their masks than I even am. I think that, once they've done it for a while, they get used to it. My little guy, he's in preschool, and sometimes he'll ride in the car with, his mask on the way home, and we have to remind him to take it off because he's just sort of used to it by now. So it's, they're surprisingly compliant, I think, especially at the younger ages. All right, so to kind of continue with our closing comments, Dr. Fogelman, would you like to go next?
Sure. I'd just like to say that I absolutely value kids. I value kids learning in school. I feel like we need to do everything we can to keep kids in school, and not just with regard to COVID, but with the other vaccine preventable illnesses also. Meningitis boosters for the 12th graders, the meningitis and the Tdap for the 7th graders. I feel like we need to do all of these things so that we can all continue to be the best learners that we can be, and the children can learn the best that they can learn in person. As far as masking goes, I see a lot of kids who do not have their masks on. They don't fit. They don't fit. So my answer to that question is the mask that fits is probably the best one. And that's different for every person. I feel like masks have been shown to be effective and safe. I don't have any concerns about, people's oxygen levels or any of those things that were originally brought up about children wearing masks. And they can do it. We've seen preschoolers, elementary school age, definitely high schoolers, and it'll help keep them there. So I definitely support that.
Thank you. All right, Mrs. Baggett, would you like to go next?
Yes, I mean, just reiterating, and Portia, while she said it best, as a student, I think as faculty and staff, we're kind of feeling the same way. We're in this together. We want kids to be in our buildings and with us and get back to some normalcy, just like we were before. So we do highly encourage our families to get vaccinated. We have a wonderful, wonderful school nurse collaborative, and our school nurses work really hard to communicate with families if they do need boosters or how they can get those boosters and where to go. So I feel like our school nurses work really hard to collaborate with our families and get them the vaccinations that they need. And beyond the vaccination, yes, if we talk to each other, educate our children on wearing the masks properly and social distancing, the hand washing, we want them to be back in school and also participate in sports. I think, in some cases I've seen, some sport programs have been what, have saved some kids during this rough time. And we want to be able to do it, but we want to be able to do it safely as well. So I think just the constant educating our kids and our families on all these safety measures will help us get back to some normalcy.
Thank you. April?
I always hate being one of the later people to go because everybody else says all the things. But just, echoing sort of the importance of getting those routine immunizations and also COVID vaccines for anyone who's eligible. If you need help getting immunizations, getting an appointment, or finding out where to go, like Ms. Baggett said, please reach out to your school nurse. They're awesome and happy to help. Also remembering, I think it's really become clear throughout the pandemic that we are all in this together, that the things that we do to keep ourselves safe, like getting vaccinated, also help keep our community safe. So it's really important for everybody to do that, especially when it comes to COVID, because our kids under 12 can't get the vaccine yet. It's important for everybody who can get it to do so, to keep everybody safe.
Thanks. Okay, Dr. Mollendorf?
Thank you. Yeah, it's hard when everybody's saying such good things. Again, ditto all that. And I would just also remind people that, before we had vaccines, these illnesses caused, significant tragedy and illness, disability, and death. That generations ago, if we can talk to our grandparents, great grandparents, they knew folks who were, who suffered the consequences of illnesses like measles and polio, diphtheria, things that we thankfully don't see as much anymore. And, I know, especially in Asheville, I often hear questions about, well, what about natural immunity and, strengthening your immune system in that way. And what I would say is, so vaccines work by giving your body a head start, right? It enables your body to get a sneak peek at a germ, and then mount an immune response, right? So it's ready to go the next time it sees that same germ. If you weren't vaccinated, your body would generate that immune response, but it wouldn't have the leg up. And you would face the consequences, the serious consequences of that illness that the vaccine is going to prevent, right? So the benefit of vaccines is that those who are vaccinated gain the protection without ever having to risk those serious consequences of getting sick. I can't speak more highly about vaccines and the importance of vaccines. And, I want all our children to be safe and have very healthy and thrive and really achieve their potential and grow up into amazing adults. And so I just implore everybody to make sure their kids are up to date. And if they're not, get them into their provider, bring them to the health department, and we'll help them stay safe and healthy. Thank you.
Thank you all. That brings us to the end of our time together tonight. So I just want to thank everyone, our panelists especially, for taking the time out to speak with all of us. Thank you to all of our listeners and watchers. We are so appreciative of just the expertise that was willing to come to the table to do this presentation. And especially given all the other things you have going on right now with the start of school right around the corner that a lot of you are involved with, and just the COVID cases that are surging right now. It was really, really kind of you all to take time out of your days to do this. And it's been such a challenging year and a half for all of us, right? But especially for the healthcare workers and educators. So I want to personally just thank all of you for just everything that you've done and are continuing to do to kind of pull us through this pandemic and hopefully keep our community safe. You're true public servants, all of you. So I just wanted to also let you know that this is recorded. This session was recorded, and you should be able to locate that on the Buncombe County Health and Human Services website, as well as the Buncombe County government website. I believe they'll also be on Facebook. There'll be links. So please feel free to share that with your school communities, your friends, family members, anyone else who might benefit from this information. And I want to wish you all a good night. Thank you very much for being here.